Elias Mackos, CJAD 800.
Okay, let's get the COVID-19 update. Sixth day of new cases over 1,100. That's the latest from the Quebec government now. 6 days in a row with cases over 1,100. The precise number for today, 1,162. When we look at deaths, 9 occurred in the last 24 hours. But adding to the tally, the total tally, 38 new deaths have been added to the tally, 9 of those in the last 48 hours. Hospitalizations down by 6. 56 people entered Quebec hospitals, 62 people left Quebec hospitals. In the ICUs, it is up by 6 in Quebec ICUs. Now 82 people in Quebec ICUs. That rolling day average, by the way, now, the last 7 days, the average number of cases, 1,171. We're right on that right now at 1,162 for the last 24 hours. A little note that at 1 p.m., CJAD 800 will have live coverage of the Premier and the Health Minister and Quebec's Director of Public Health as they address Quebecers and answer questions from journalists. Let's take a closer look into COVID-19 and also take a look at the prospects of a vaccine. How optimistic should we be about having a COVID-19 vaccine by the end of the year? Dr. Christopher Labos joins us on the line, cardiologist, degree in epidemiology. You can hear him on Sundays on CJAD 800 when he does his Sunday morning house call at 8:10 with Ken Connors. How you doing, Chris?
I am not too bad. How are you doing?
I'm okay. First reaction to the latest COVID numbers, 6 days in a row above 1,100. Any thoughts on that?
I mean, I think the reality is when you look at the numbers that this virus is not going to go away with the current situation. We are probably going to be stuck at these numbers for a while, certainly for probably the rest of the winter until spring and summer comes again. So it becomes a question of, can we live with these numbers with the current degree of restrictions? Or do we want to impose much more stringent restrictions like they did in Australia and New Zealand and as they're doing now in many parts of Europe in an effort to drive the numbers down again? And it's going to be a cost-benefit calculation about, do the economic costs versus bring down the number of hospitalizations? Like where does the ideal spot of that balance lie? And unfortunately, everybody's going to have a bit of a different opinion. But as it is now, we're probably going to see numbers like this for the foreseeable future.
And then, with that in mind, do you view it positive that we're not seeing exponential growth, the sort of stagnant 1,100 now for a week? Do you view that in and of itself as somewhat of a good sign?
Yeah, it is. I mean, here's the thing. The situation could be better, but it could also be worse. Remember how things were in September when we went from, over the course of a very short period of time, we went from 100 to 200 to 400 to 800 cases. There was a very real concern that this was going to explode out of control. So the current restrictions that were put in place, the ones that were put in place beginning of October, have at the very least stabilized everything. So the situation is not getting worse. But for people who are asking, well, why aren't the case numbers going down? Well, they're not going to go down unless one of two things. Either people are they themselves going to voluntarily limit their contacts even more, or the government has to impose some degree of restriction, a tighter lockdown if we want to drive the numbers further down. As it is, we're holding steady for now.
Now, it's one thing if I get excited when I hear news, there's a vaccine and it's 90% effective. I can get excited because I know nothing about medicine. I did not go to medical school, right? I'm just a guy that wants things to get better. Yeah. From you, and your perspective, how do you view this news this week of this seemingly successful trial and the 90% efficacy of this vaccine?
Oh, I am cautiously optimistic. Now, this is just the interim analysis. The trial is not done yet, so we'll have to see what the final results show. But, I mean, assuming that they stay consistent with what this sort of halfway analysis is, because they haven't recruited all the patients, they haven't gotten all the data yet. But based on the data they have so far, what Pfizer is saying, what they released in their press release, is that the vaccine does seem to be effective. They haven't seen a safety signal. So as long as this pans out when they do their final analysis, which will probably come in about a month, maybe, more or less, if that stays consistent, then that vaccine will almost certainly get approved. And so there may very well be a rollout of the vaccine early in 2021.
With Dr. Christopher Labos, we're talking about a prospective COVID-19 vaccine. Now, one of the things, Chris, is that this vaccine apparently has to be stored at very cold temperatures, like minus 80, right?
Mm.
And I guess the question I have is, because I know some vaccines, you need to keep them cold,
Yeah.
but how common is that? And do you see this as being an issue, or is like, oh no, we do this for a whole bunch of vaccines, this should be no problem? How do you perceive that?
I mean, I don't think that's going to be the rate limiting step. The real challenge to the vaccine is, first of all, because here's the thing: people think that once the vaccine is approved, all of a sudden, like 20 million doses are going to drop on our laps. It takes a while to produce vaccines. It takes a while to distribute them, to get them out to hospitals and clinics, and to vaccinate people. So, yeah, I mean, the storage, the transportation, all of those are logistical issues. That's not the thing that, is going to keep me up at night. The challenge is going to be rolling out this vaccine, which is probably going to take months. So when people say, when should we expect the results? We're expecting the results to get published, like I said, maybe in a month, so probably before the end of the year. We'll have the results, the final study results to say this vaccine works, yay or nay. But the amount of time it's going to take you to actually get vaccinated will probably take months just because of all the logistical issues of getting the vaccine to people. So all of that is going to become somewhat complicated. Yeah, the storage is another sort of wrinkle in it, but I mean, that's going to be easy to figure out. It's really going to be the mass production of this vaccine, because you're going to have to produce, or the companies are going to have to produce millions upon millions of doses to vaccinate, if you think about it, nearly everyone on the planet.
Dr. Labos, be well. Have a great day.
You take care.